I know some of you may be saying, yeah, but my quality of life is so much better when I take that pain medication. So I would just ask you to consider some of these things I'm about to talk about. Your quality of life, your perceived quality of life through pain might be better, but look at some of the side effects. So these are different classes of medications. I'm just going to kind of go through this diagram with you, but drugs that cause gut dysfunction. And so not all drugs that treat pain cause gut dysfunction. In essence, other drugs can create gut dysfunction as well. Many drugs are kind of what we would call an equal opportunity gut destroyer, right? So as we look at kind of some of these things. So in the mouth, we've got pain and anti-inflammatory medications can cause the gums to bleed. So in the mouth, pain medicines can cause bleeding gums, which means you're starting to see your gum line erode, which means your dentition is going to suffer, which is going to make you more susceptible to malnutrition over time, because as your gums are bleeding, you're more apt to lose your teeth. The tongue, we've got antacids, antibiotics, hormones, anti-inflammatories, diuretics. This is if you're on blood pressure medications that are diuretics. Antiviral drugs, so those of you that might take a drug for like a herpes outbreak or mouth sore outbreaks. Blood pressure medicines, allergy medicines, cholesterol-lowering drugs, and antidepressant drugs can all alter your ability to taste your food. Now, one of the fundamental problems with altering taste is people change. We'll just use a triangle for that means delta. That means change, right? They change their diet. Typically, they increase sugar and salt, because the altered change is a reduction in the ability to perceive taste. Okay, so when you can't taste, you tend to add more things that add taste to the food. For most of us, that's sugar and salt as a byproduct of that. Now, one of the reasons why these different classes of medications oftentimes alter taste, not all of them, but one of the main mechanisms of altered taste is a reduction in the mineral zinc. Many of these drugs affect your body's ability to digest, absorb, and to assimilate zinc. And zinc is very critical in both our ability to smell and taste. So a lack of zinc can lead to gustatory problems or tongue problems or taste issues. And so that can be an issue. The gallbladder. So the gallbladder is part of our GI tract, even though it's not classically considered our GI tract. You kind of look at your gallbladder right here. It's that little sac right next to the liver that secretes bile into the small intestinal area, which starts right here in this little section. So that small intestinal area, the bile is what helps you to digest and absorb fat. So that's vitamin A, vitamin D, E, and K, omega-3 fatty acids, all critical. And if we take medications that affect the function of the gallbladder, so one of those is hormone therapies like estrogen. Okay, so it's a side effect that many doctors fail to discuss with their patients. Cholesterol-lowering drugs can affect the gallbladder, especially what are called bile acid sequestrants. Not so much your statins, but bile acid sequestrants, which are drugs that bind onto your bile, or that affect your bile, and so therefore make it harder for you to produce it. And it can, again, it doesn't change your gallbladder, but it changes what your gallbladder is supposed to do. Then we have drugs that affect the liver. So one of the predominant drugs that affects your liver function is Tylenol or acetaminophen for pain. So a lot of people take the drugs for pain, the Tylenol for pain, not knowing that it actually depletes the liver of glutathione. And then there's anti-inflammatory drugs, cholesterol medications, antiviral drugs. They can all cause liver dysfunction. And the more that you're on, and this is what we generally tend to see, so arthritis or pain is more common it increases with age. And so what also increases with age is the amount or the quantity, the number of meds increases with age as well. So we've got arthritis increases with age, and number of meds increase with age, and number of meds, the more you take, the more it impacts the liver. So again, as you age, if you're taking more medicines, the more you impact your liver, the more susceptible you're going to become to drug side effects, which is part of what we're talking about here. We also have drugs that can slow down or hinder digestion. As a rule of thumb, antibiotics, antacids, pain, and anti-inflammatory drugs. You see these are making kind of waves in a lot of different areas here. And then gas, bloating, diarrhea, constipation can occur with the use of antibiotics, antacids, laxatives, hormones, blood pressure medications, diabetic medications, cholesterol-lowering drugs, and antidepressant medications. So that's almost every major class of drug that is a common kind of tool in the toolkit of most doctors today. So you go to the doctor, there's a pretty strong likelihood you've been given something in that realm of medications. All can potentially impact your ability to digest and absorb. And then we've got on the other side of this equation, we've got drugs that can affect the salivary glands, like chemotherapy. So if you've ever gone through, conventional cancer treatment, these drugs can affect your ability. They can damage your salivary glands and hinder your body's ability to secrete. Salivary glands help with digestion, but they also help you to secrete IgA. What is IgA? IgA is your primary antibody. It's your first line of defense antibody. You make it in your saliva, and these medications suppress that. So it can make you more susceptible to infection, among other things. You don't want to have dried out salivary glands that aren't secreting IgA. Your esophagus, pain medications, anti-inflammatories, antibiotics can cause pain with swallowing, which can lead to the inflammation of the esophagus. And then we've got drugs that affect the stomach, like chemotherapy, anti-inflammatories, antibiotics, acid reflux medications, antidepressants, hormone medications. All these have been shown to damage the lining. So the lining of the stomach gets damaged or can be damaged with these different types of medications. And then drugs that affect the pancreas, predominantly anti-inflammatories, antiviral, and pain medication can cause indigestion and inflammation of the pancreas. And then the small intestine, kind of the same group of drugs that affect the large intestine. So again, your antibiotics, your anti-inflammatories, your oral contraceptives can interrupt absorption and digestion. Now, I did a whole show on estrogen and leaky gut a couple of weeks ago. If you didn't watch that, you might want to go back and watch that. This is part of some of the things that I'm talking about. But most of your medications, my point is, most of your medications cause gut dysfunction, right? Or liver dysfunction, which makes you more susceptible to the increasing number of medications that doctors generally want to put you on as you age, as you become symptomatic. The key here is that don't buy into the thought that just because you're aging that you're somehow supposed to be on more medications. Look, a lot of people that come to see me, they'll follow through with their doctors, and their doctor, when they're not on any medication, the doctor say, what are you taking? And they'll say, I'm not taking anything. And they may be in their 60s or 70s, and the doctor's jaw hits the floor like, how could you not be taking any drugs? As if your body is so broken and so fragile that without the drugs, you're somehow going to die or not be able to function. This is a common misconception and myth. So again, remember, why are we talking about this as it relates to pain? Because many of you are on medications, and whether you're taking medications for pain, okay, which again, alter GI function, nutritional deficiencies, inability to heal chronic persistent illness, or whether you're taking medication for some other reason that's not pain-based, you can actually still create the GI dysfunction, which leads to the nutritional depletion and to the other damage to your liver and other organs, again, that can affect your body's ability to heal and repair itself. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.